some helpful tips and tricks that your healthcare provider wish you did or know before coming in to see them. Hi, everybody. My name is Anastasia, and welcome to my channel. If you've been here before, thank you so much for coming back. If you're new, come on and make yourself at home. Here we talk about everything. So, I wanted to share some helpful tips and tricks that your healthcare provider wish you did or know before coming in to see them. So, first thing, make sure you go prepared. We don't have a lot of time that we spend with our primary care providers, especially, and even specialties. Like if you go to your OBGYN, it's like in and out quick. The time is very limited, 15, 20 minutes tops, and we're just like going in and out. So it helps when you go in prepared. Make sure you write down all your questions, all your concerns. That way, when you go in there, you're not going to forget anything. You go in prepared, you're a little bit more calm. You're able to listen and absorb whatever information you are getting. So, first tip, make sure you go in prepared, write down all your questions and concerns. Next is make sure you go with a list of all your medications that you're taking, any supplements, any changes in your health condition. If you went to the ER, if you went to the urgent care, write it all down. Because sometimes you go to your primary care physician, maybe you saw a neurologist or a urologist or OBGYN or any other kind of specialty, and they give you a new medicine or they change some of your medicine. Make sure your primary care doctor knows about it. That way, they can monitor if they need to check your kidneys, your liver, any blood work that needs to be done, if any of your drugs are interacting with each other, any supplements, any over the counter medication. Make sure you go with a list. You can even take the whole bottle, just bring everything. That way, you're giving them all the information that you can give them, and they can make better decision regarding your health. So go in prepared, write down all your questions or concerns, go in with a list of all medications, any changes in your health condition, any other doctors that you've seen since the last time you saw them. Bring all that information when you go to see your healthcare professional. Know that we're not there to judge, we're just there to help collect information, process the information, and give you answers as best as we can. So if you haven't been taking your medication, let them know. If you've developed some weird, rash or something and you're shy, you don't want to be judged, you don't want them to think, oh, what are you doing? Like, why are you getting? No, we don't judge. The more information, the better information, the truthful, accurate information you give us, the better we are able to process, the information and give you the best possible diagnosis. Remember, what you tell your healthcare professional is what they're gonna like that information is what they're gonna base their answers for. So if they ask you, do you have pain? And you say no, okay, you don't have pain, so then we're not going to deal with pain. Meanwhile, you have pain, but you don't want to talk about it because you're scared that you might be judged of where the pain is. We don't care where the pain is. We're not going to judge you. Tell us the truth so we can better help you. Next is ask questions. If something doesn't make sense, make sure you ask questions. There's been so many times, even me as a professional, I'll go to see my doctor and I'll come out and I'm like, wait, this doesn't make sense. And, then I'm going to try to call, and trying to call your doctor's office is such a hassle. So when you have them face to face, that's the best time to ask all your questions, get everything answered, make sure everything makes sense before you leave. Because once you leave, it's just harder to get a hold of them. And a lot of times, like, you know, especially primary care. I keep talking about primary care because it's just brutal. You're seeing 20 plus patients a day. It's just sometimes hard to make the connection over the phone. So when you are in person, they can answer questions pertaining to you versus just somebody on the phone that you're talking to. So ask questions, make sure everything is clear, because sometimes we will be talking to you and using medical jargons that we understand, but we forget sometimes that a lay person from the street might not understand. So Let them know. What is, you said this word, what does that mean? What do I need to do? This, that. Make sure you are asking questions, making them make things clear to you. And the last thing is that follow up. Make sure you know what the plan is moving forward before you leave in your doctor's office. If you're ordering blood work, ask them, when do I get the results? Who is going to call me? What do I need to do after that? Ask very specific questions. That way, you know exactly what the picture is. You see the whole picture. You understand the plan, what to do moving forward before leaving the doctor's office. Also, make sure you're asking when your follow up should be. Let's say you're seeing them for a well visit. Ask them, do I come back in 6 months? Do I come back in 1 year? Make sure everything is clear before you leave. All right, I hope these tips and tricks were very helpful to you. If you have any other questions, any other concerns, please leave it down in the comments below. Share this video with your friends and family. Comment, give it a thumbs up, leave an emoji down in the comments. Any little bit that you can do to support the channel is greatly, greatly appreciated. Thank you for watching, and I'll talk to you soon. Bye.